Hello everyone, we are Group 13, and today we're going to discuss our project on the impact of student pharmacists asthma counseling on underserved participants' understanding of asthma and inhaler technique. Before we get started, we would like to disclose that we have no possible financial or personal relationships with commercial entities that may have a direct or indirect interest in the subject matter of this presentation.
Respiratory reactive airway disease is mostly related to pediatric patients, and this includes many types of respiratory insult, including asthma. It's been shown that when pharmacists provide counseling sessions, there is a positive health outcome associated with the patients who were counseled. On the other hand, there is limited literature on how effective a student pharmacist counseling is. Furthermore, there is even less literature on student pharmacists counseling pediatric patients with asthma. One of the few studies done has shown the effectiveness of student pharmacist counseling on a child's asthma knowledge. However, this study was designed to implement asthma self-management education intervention. The primary objective is to determine if a counseling session performed by a student pharmacist has an impact on a pediatric patient's understanding of asthma medications. The secondary objective is to determine if the child's level of understanding is impacted by child's stage of development. Methods. Children aged 5 to 15 were selected from the Boys and Girls Club of Tampa Bay. We used a standardized counseling script for all children counseled, and there were 2 researchers in each counseling session. Prior to counseling, the child was given a 5-question pretest to assess their knowledge on metered-dose inhalers or MDIs and asthma. After counseling, the post-test responses were collected using the same 5 questions from the pre-test to assess their knowledge on MDIs and asthma.
Now I will discuss the results of our research project. Initially, there were a total of 2 Boys and Girls Clubs that were selected to participate in the data collection for our study. However, one of the locations was ultimately excluded due to scheduling conflicts between the researchers and the Boys and Girls Club site. We ultimately sent out parental permission slips to a total of 50 guardians at the Tampa Bay Boys and Girls Club. The children at the club ranged from 5 to 15 years of age. After the permission slips were provided to the guardians, 13 of the guardians signed the form, 5 refused to let their child participate, while the remaining guardians did not respond to the forms. Out of the 13 eligible children with permission from their guardians, 4 of the children were unable to participate in the counseling session because they were picked up early from the Boys and Girls Club site and were therefore unable to attend the counseling session. In the end, a total of 9 children aged 6 to 12 years old participated in the study. And as for the demographics of the participants, 67% were boys and 33% were girls. 67% were Black, 11% were Hispanic, and 22% were unable to identify their race. In conclusion, 78%, or 7 out of 9 participants, demonstrated an improvement in their post-test score when compared to their pre-test score, while 22%, or 2 out of the 9 children, showed a decline in their overall post-test score, with a 95% confidence interval of 2.2 to 6.8. These results are displayed in Figure 1 of our poster as well. Both of the children that demonstrated a decline in their test score were 7 years old. Overall, the scores of the pre- and post-test were similar amongst all age groups.
Based on the results that were previously discussed, the data indicates that an education session performed by student pharmacists may impact a child's understanding of asthma and its associated medications. This is supported by the improvement in scores after the education session. Although our results did show that 78% of the participants had an improvement from their pre-test to post-test scores after the education session, it's hard to determine if this was due to our education or if this was due to chance, due to the fact that we only had 9 participants. On the other hand, some participants did show a decline in scores from the pre-test to the post-test. The unknown reasons for the decline warrants additional research and a reassessment to modify the current study approach. Additionally, even though comprehension increases as a child ages, there was no association between a child's stage in development on understanding, as the scores were similar among all age groups. Aside from our small sample size, another limiting factor with our study is that a majority of our participants may have come from low-income families. Thus, the assumption of education level among said participants may vary and may have affected the results of the study. In order to strengthen the association seen in this study, more participant diversity for future studies will be essential. This will help us to understand if the education level did affect the results of the study. Additionally, we would also want to increase the population size, as this is necessary to determine if student pharmacists counseling children could increase their understanding of asthma and its medications. One way to increase the population size is to go to more boys and girls club sites. Another way to increase the population size is the way that we distributed the informed consent forms. How we distributed the informed consent forms was we gave them to the Boys and Girls Club and they sent it home with the parent or guardian. Therefore, the parent or guardian did not bring back the informed consent form to the Boys and Girls Club site. If we were there at the Boys and Girls Club site, we could have handed the parent and guardian the informed consent form and explained to them what our project was about, and then see if they have any questions, and then we could have had them sign it right then and there. This would have increased our population size significantly.
In conclusion, our study did show that student pharmacists do have an impact regarding to the counseling points of patients' disease state as well as medications associated with this disease state. And these results can have clinical significance regarding to how healthcare providers can incorporate either student pharmacists or pharmacists in general in the care of a patient as it relates to counseling the patient on their medications and the disease states. And also, furthermore, it can be shown that including patients that are ages 5 and up, in addition to their caregivers, can have a greater impact in allowing them to understand their disease state as well as the medications associated to that disease state.